These are, I'd like to introduce our friends from Atlas AI, who they'll be leading the workshop. First, Karen Burns is the Director of Partnerships at Atlas AI, where she leads the company's development sector interface and open data strategy. She has an in-depth experience with multi-sectoral collaborations, impact evaluations, and scaling public-private partnerships across Sub-Saharan Africa, India, and Latin America. And she holds a PhD in community health science and MPP from UCLA. And we also have here Devin Desai, who's the head of product at Atlas AI, where he leads the company's go-to-market strategy, most recently with Planet Labs. Devin has a decade of experience in remote sensing application development, distributed computing, and commercializing technologies in emerging markets. He holds an MS in information technology at DePaul University. I'll hand it over to both of you, and I think you have one other colleague joining, if you wouldn't mind introducing her as well. Thanks.
Thank you, Sam. Hi, everybody. We do have our other colleague joining us, Shruti Jain, and I'll turn it over to her to let you all know who she is.
Thanks, Karen. Hi, everyone. I'm Shruti, and I work at Atlas as a data scientist. I've been here for more than about a year now. And I run point on a lot of our work with the World Bank, especially in the agricultural vertical. And I happen to be from Cal. I completed my master's in public policy from the Goldman School in fairly recently. And I've also worked as a researcher at the Global Policy Lab there. So yeah, excited to be here.
Excellent.
Yeah, I'll turn it over to you, Karen.
Okay, perfect. I am going to share my screen. Can you see my screen, Devin, Shruti?
Yes.
Perfect.
Yep.
Okay. Hi, everybody. Like Sam said, I'm the Director of Partnerships here at Atlas AI, and Devin, Shruti, and I thank you for being with us today. We're really excited to share more about our work and our open data with this group in particular. It's our first opportunity to connect with the global health community in a forum like this. And we're really interested in learning about how we can make our tools and our data relevant to your world, which is my world too. But now I'm at Atlas, and so we don't get to do much work with the global health community. So very happy to be back here. So the way that we've broken up our workshop is into 3 different sections. So first, we're just going to talk. We're going to share a little bit more about Atlas, our story, our business model, because it's really unique and it's interesting. And kind of the mix and how we're set up allows us to go into some different spaces. And then I'm going to turn it over to Devin, who's going to walk the group through our platform called Aperture. It's exciting, it's new, it's in development. And then as part of our, basically our tier 1 plan into Aperture, which Devin's going to kill me because I just said the name wrong, but part of the plan, as everybody on the call can access Aperture right now, you have access to our open data. So we're really excited to kind of bounce some ideas off you, understand if this is valuable to your space, what would make it more valuable, less valuable. And then the third part of our section, we're going to walk you through a really interesting study that we're really proud of, that we had a big kind of company-wide effort to put together an analysis that we hope can contribute to COVID-19 recovery efforts. So we're going to do a walkthrough of that and then talk through some of the public data assets that we've made available for people, especially in your world. And so despite remote everything, we are aiming to make this as interactive as possible. So it's a big group, and we need to communicate with all of you through the chat function. So please be chatty, stick your questions in the Q&A. Use the Q&A box. If you send them in chat, we'll get those as well. But send them in as they pop into your brain. What we're going to do is, in the first section, Shruti is going to be running point on questions, and she's going to be able to answer the ones she can in the chat. And then she's also going to be batching some questions that might be applicable to the broader group or need more of a discussion that Devin will answer at the end of the Aperture section. And then we're going to do the same thing during the COVID section. So whole point being, throughout, just stick your questions in the chat, and we're going to answer them in the session. And then if we get inundated with inquiries, we will follow up to anything that we don't talk about today. We'll also be sharing our contact information at the end of the session. So we definitely encourage people to reach out to us directly, like during this and after the presentations. And we'd also just love to know who's here with us in Zoom land right now. So if you're so inclined, please stick your name, your organization in the chat, in the Q&A, sorry, so we know who's here with us. And okay, so we already did our introductions. And so we're gonna just skip through this slide and talk a little bit more about Atlas AI. So what we are at Atlas, we're a software company that's working to aid resource allocation in emerging markets. And so we exist as a firm to monitor the drivers of economic development across the emerging markets with the hopes that financial capital can advance societal well-being. And we're a relatively new company, just established in 2018, but our science and our approach is not. It's really built on decades of work by our founders that are over at Stanford University. It's Dave LaBelle, Marshall Burke, Stefano Ehrman. There's probably a lot of folks on this call that know these folks, have worked with these folks. David, Marshall, and Stefano are in the fields of agriculture, ecology, economic development, computer science, respectively. So essentially, they've been trying to create better data for decision making for a really long time. And they've been working on some really pioneering methodology that's essentially at its core the interface of survey and satellite data that they've been able to push out into a lot of academic and research spaces. And then also it's led to a lot of like spectacular collaboration, like in the past, and ongoing collaboration with the bank in particular. And when we talk about Atlas, we always like to say that we're a company of some really interesting intersections. So first, there's like the intersection of the underlying methodology and work that David and Marshall and Stefano pioneered. So they joined forces years ago to conduct this research that showed that satellites and machine learning data could be combined to measure and understand a range of economic indicators in areas with very limited on-the-ground data. So at the time, this was really new and not a lot of people were doing this. Fast forward to now, a lot more people are doing this and take advantage of this like really important technology. And so at the time, kind of backtrack 6-7 years ago when they were sitting on this, like they knew their findings were extremely powerful. And then they also knew that they needed help to basically help expand it outside of academia and kind of getting through some of those silos. So herein kind of entered Rockefeller Foundation. So they were our first big partner and investor that came in and said, we want to help you guys do this. And then herein lies like the really second, really interesting intersection that's kind of core to Atlas. And this is our Series A funders. So we did decide to go the venture route when we pursued our funding. And we had this really interesting mix of philanthropic and commercial support. So Rockefeller stayed engaged with Atlas through our Series A. And then Airbus Ventures was our lead investor. And then we also got a nice contribution from Micron Ventures. So this unique mix of investors combined with our designation as a public benefit corporation allows us as a group to establish a really interesting balance between our continued interface with the social sector, with academia, with research, while expanding our commercial outreach. And it's because of this that we're able to work pretty seamlessly with organizations like the World Bank. We can partner with organizations that are more a little academic, research leaning, like National Science Foundation, while concurrently developing our commercial strategy. So it's a really cool space to be in right now, because not only are we're building this ship as we go, but we're trying to really take advantage of this unique designation and this unique time in the company's history to kind of set this up for success so we can continue to expand in different ways. And then, so last but definitely not least, when it comes to intersections here at Atlas, is the intersection of our data. And this is really just this really interesting thing that's happening in the company. So at Atlas, we currently create and maintain rich data sets on household level asset wealth and consumption indicators, a range of agricultural productivity indicators, and infrastructure access and reliability. And right now in that infrastructure bucket, we're currently focused on electrification, and we're actively expanding that portfolio of work. So today we're going to discuss our platform, which is called Aperture, and our COVID case study analysis in greater detail that take advantage of our economic data, our asset wealth data in particular, in combination with our electricity data. So we're going to go into a lot more detail about what both of those data sources are, and especially what our open data assets are in those spaces. But I do want to emphasize that our approach as a firm is to create the data and tools that people need to understand how each of these different spaces operate and how they interrelate. So as we all know, working in multifaceted spaces in the development sector, things, as much as we try not to, things tend to get siloed. So we do hope that this is one of many tools that helps to kind of decouple and de-silo information to help everybody in working in all these sectors and beyond make better decisions. And the last slide of our intro, we like to highlight to just kind of core is scientific reliability and replicability. So understandably, the first question that we get when we talk to anybody is, can your information be trusted? And can our methods that derive the data that we create be trusted? So largely in part to our academic roots, much of our methodology has been rigorously tested and peer reviewed in prestigious journals like Nature Communications and Science. And we definitely have made a commitment as a firm to continue that transparency and that commitment to academia, to research, to publishing. So we always are thinking with that in mind as we create new tools and new data. We want it out there. We want people to question it. We want people to understand what it is. And we want it to be part of the academic literature as well. And we also like to mention that we don't take the burden lightly. Like, we have the really unique opportunity to create data that decision makers use to allocate massive amounts of information and helping a lot of times the most vulnerable people on the planet. And we know that our data, these statistics in combination with organizations like yours, determine the future of millions. And we're really privileged to be in this space. And we definitely have it at the core of our being at Atlas to make sure that we create reliable, good data that people can use and are very transparent in what we do well and what we don't do well. We don't want to put anything out there that people have some ambiguity around of what exactly it is. And just on a small side note, all of our publications can be found on our website, and we'll share that URL at the end of the presentation. So with that, I'm going to turn it over to Devin, who is going to talk about Aperture.
Hello. Karen, I'm guessing you're still doing the slide sharing, and then I'm just going to tell you next slide, or?
Nope, now it's over to you. Now you can
Okay.
share.
Yep, happy to do so. Just give me 1 second here. Going into present mode, and let me know when you can see the screen. You should be able to see it now.
There we go.
Okay, cool. Oh, jumping the gun here. Great. So let me go ahead and set the frame a little bit here before we go ahead and kind of talk about different data sets. I think as I was leaving Planet and coming to Atlas AI, a big part of the problem statement that we noticed was, it's interesting to generate lots of satellite imagery. It's interesting and very important from an agricultural perspective to be able to get this data set out there as frequently as possible and to as many people as possible at the right price point. But in a lot of different problem spaces that aren't as direct as agriculture, where you can kind of just look at the vegetation index, for example, or the water index, and kind of get a measurable value on a daily basis, it's a lot harder to solve a lot more intense problems related to economic livelihood, infrastructure, and you really need a whole bunch of different data sets coming together as inputs in order to actually come and arrive at a good conclusion on what is actually going on the ground. So a big part of what we want to do here is kind of see in the emerging and frontier market space, which hasn't seen as much of an adoption of the same kinds of data sets that are prevalent in the developed nations, certainly in the developed markets across a few variety of use cases like precision ag. We want to be able to provide that same kind of information to these sectors. I think for us, it's to imagine a world where we can kind of make data-driven decisions and to be able to do it by sitting at your desk kind of anywhere in the developed world, but also when you're going there in the field, when you're going there to actually affect change, whether it is through an intervention or through an investment inside the continent, it's important for us to be able to make sure that this data set is validated, that it's actually useful, and that it actually can answer a lot of the meaningful questions that we kind of need to make sure we do. So having said that, I think for us, we kind of look at it in a different context. So let's just take a look at wealth and economic consumption on the one side, and then use that kind of as the proxy to kind of talk about the data freshness piece on our side. So if you look at the diagram here and on the African continent, I think you'll notice there's a significant disparity across the board in terms of how quickly or how slowly information actually comes from the given nations in terms of understanding consumption or understanding asset wealth. A lot of times this data is just at the national level. As we talk a little bit later in the demonstration of the Aperture platform, maybe it goes down one level below to subnational, but it's naturally not going to go any more granular than that. And if it does try to do that, then the frequency at which that survey actually comes through is quite slow, right? And it's not, helpful when you're looking at 5-year-old data in order to make decisions on what just happened over the course of the last year. And so a lot of the theme of today's topic is COVID. How useful is it when you don't understand population density and how it's changed over the last 5 years in order to actually affect what's going on? How useful is it when you don't really understand how asset wealth has changed over the last decade in order to understand where the underrepresented populations are? And so with that in mind, we really strive to make sure we do a few things here. I think coming from the planet world, sometimes we're a little aggressive at Planet, where to us, near real time is daily or near daily. Resolution is like 3 meters per pixel, and even at that point, it was considered coarse in the remote sensing world. But when it comes to making decisions, when it comes to actually understanding how different policymakers and when different intervention programs actually happen, that is incredibly precise information, and at some points it's not even of great value because there isn't any extra importance that comes to it. But what is important is making sure that you can get the same kind of information reliably produced across a broad geography. And so for us right now, that focus is Africa. For us, it's also important that we get this data sets refreshed at a consistent cadence. So it doesn't need to be exactly the same cadence for every data set, but it does need to be that it needs to be updated at a predictable and reliable measurement so that you know what you're accepting as an input in order to make the decisions that you're doing. So if we take into account asset wealth, for example, we try to make it so that we can do the refreshes to asset wealth on an annual basis, right? And so obviously for now, it's only until 2020 because we're in the year 2021. Observations are still being done. We're probably going to be doing a few more surveys going into the course of this year, as well as taking into account other public domain data sets to produce 2021 data in early 2022. So that's kind of the cadence there. It's the same thing with economic consumption. What is the purchasing power per capita in any given location? What is the ability for them to purchase, and how it has been the trend over the last 5 or 6 years? I think the reason we say coming soon is primarily because we're going through a fairly stringent QA process to understand there is a dollar number associated to this. We don't want to just make something up and then throw it out there. Significant amounts of validation needs to be taken in place. We need to also offer a heuristic to say there's a low, medium, or high confidence to the number that we're attributing per capita to a particular location. So once that's actually done, we're hoping to get this out the door in the next month or so, and that's going to be incredibly powerful in order to understand what's going on from an intervention standpoint. Same thing kind of goes for population. Lots of wonderful institutions out there are making population data, both in the public sector and in the private sector. Facebook's made important strides here in trying to make sure what's going on. The GSSL data is out there, Landscan's there. A lot of these works are great. And I think for us, for now at least, it's important to understand how to create a single layer that has the most amount of agreements, that takes into account a composited approach, and it's available in order to actually provide the right kinds of granularity to make the decisions you want. And then same thing goes for electrification. we could probably push this to weekly. We could probably push this to daily with nightlight information that comes through. But is that actually going to provide the right signal to noise ratio? And so at the end of the day, what we focus on is monthly updates that start in 2012 and end for now until 2019 December, but all of 2020 is currently being processed as well. And the whole point here is to say, not just let's take nightlight data, which is satellite imagery from nighttime, and just extrapolate to see where all the bright spots are, but what are the temporal trends? You know, what's the relative luminosity change? What are areas where there's reliably produced electricity? How recently did an area get electrified? We'll talk about a lot of this stuff. And then of course, we've got some agricultural data sets that are going to come through as well. But you know, for now, they're on demand and on request as we do engagements with certain customers. So that's kind of just the gist of what we kind of focus on from a data standpoint. If I was to kind of, you know, dive just a little bit deeper into two of them, we're going to focus on asset wealth and we're going to focus on electrification for today's presentation. This is kind of where we like to kind of talk about, you know, the temporal resolution, which is the cadence at which it's done. For now, the 4-year stuff is what you're going to see demonstrated in the platform. However, all the annualized stuff is currently getting processed and getting out the door. The spatial resolution is 2 kilometers, which means that, you know, for every 2 kilometers on the continent in Africa, you could be able to kind of ascertain what a given value is. We'll demonstrate that as well. And then at the end of the day, you know, the interpretations are important because the inbound data is coming in through DHS surveys, LSMS surveys. If you know, members of the World Bank here might know that data set for sure quite well. And we take those as baselines. We have our own other survey data sets through partners that we grab, as well as different methodologies that Karen mentioned earlier that have been published already that are known and as defensible ways to actually create this particular metric. So all of that kind of put together isn't enough because you still need to produce that data. You need to maintain it. You need to make sure that if there's tweaks or adjustments that need to be made, then you're still on. Someone needs to actually own the ability to produce that data set and provide it as a reliable service. And we're certainly, you know, that party that does that. And we're very excited to make sure that as we go forward, our asset wealth information is going to get just even more verbose. We're hoping to introduce a growth rate layer, which is kind of just taking into account what has been the temporal rate of change over the last, you know, years starting 2003. A lot of times these types of derivative data products can, you know, seem small, but can provide a significant amount of value for someone who's just trying to answer a particular question. So that's asset wealth. Same thing kind of goes for electrification. You'll notice that our resolution, if you will, is actually a little bit finer on the electrification side, but for the purposes of visualization and for the purposes of making sure we're comparing apples to apples, things get resampled in our Aperture platform to 2 kilometers. So across the board, you can consistently expect that all data sets that we have at the most granular level will be normalized to a 2 kilometer resolution. And that's kind of the context here. Like I mentioned before, we use a whole bunch of nightlight data. There's a whole bunch of processing work that happens as well. And we have a bunch of partnerships with institutions like the Colorado School of Mines who are helping us in making sure that the data set that we generate is actually quite reliable, producible, and actually something that can be usable by parties, both nonprofit and also on the private side, on the commercial standpoint. So having said that, here's a quick little teaser into how that kind of looks. In this situation, kind of what you're talking about is just the, you know, like resolution at the subnational scale. But as you start zooming in, you might want to actually get details at the district level, at the local level. And then at that point, you might want to get district details that actually go down all the way to the settlement level. And so that's the kind of data sets that we're talking about. Most, I think, folks that we've been speaking to in this space are used to data sets at this level on a best case scenario. And we kind of want to push the needle there and kind of see like where we can go to give far more details. So in short, a lot of times use cases kind of revolve around questions to need to answer. And so in this scenario, let's say that you're looking at Burundi and Rwanda and you want to understand, hey, how much of the asset wealth you know, situation is going on for the populations that are between the 33rd and 66th percentile, and where are they? Which areas have a population density also of at least 350 people per square kilometer? And also, where has there been only a maximum of 5% of that area within that given district given access to electricity infrastructure? This might be important as a series of criteria for a particular intervention. You can imagine it's the flip side as well, because you might want to understand and detail particular areas where you want to go survey. In these scenarios, in the traditional manner, you might have to go through a multitude of sources in order to pull together data. You might need to do a whole bunch of your own post-processing, and then at one point you'll be able to answer these questions. What we want to do is, for this type of scenario, you should just be able to go to one tool where all this stuff is already pre-indexed, pre-ingested, and you're able to now start to actually conflate and superimpose different data sets to kind of get to the answer a lot quicker. And that's really what that situation is about. So if we talk about key applications, it's not just on the healthcare space that we want to focus our attention. We're happy to be here. We want to make sure that as just stewards and members of a community, we're able to provide data sets related to COVID-19 out into the world. But most of our actual work can also go into the market sizing side of the equation, infrastructure, site selection for producing solar mini grids, and then also optimizing resource allocation as you have program targeting work you might need to do, or if you're doing a direct cash transformation, that this is actually a much more meaningful way to understand how to direct that money into the right locations and the right purposes. A couple of the key highlights, I think I'll end before we go right into the demo, is interoperability is very important to us, right? A big part of what we want to do is not just to say we have this proprietary platform and therefore you can only access the data here and that's it. As long as we have a good relationship, either at that public plan that Karen was talking about when she made the reference to tier 1, as well as any other commercial situation that we have with any of our existing customers, interoperability is very important to us. We want to be where our customers are at and give them access to our data there. So if you work in the Google Cloud platform, we'd be happy to make sure we push data to a bucket that you already host and maintain. If you're on the ArcGIS ecosystem, we want to make sure that all of our data sets can live in ArcGIS Online. We can add you as a group and provision that data sets to you right then and there. So you don't need to actually come to us, download the data, re-upload it back to ArcGIS. We'll just make it so that it's available there, and then it's easy for you to do so. We want to make sure this can go even further as far as workflows are considered. If you need to actually make certain applications through the Esri infrastructure, we want to make sure we can kind of help you there as well. The whole point here is it's a systems integration component and a data integration component. And we want to be where our customers are. For us, the data set shouldn't just live with us. It should live where it's most impactful, right? And that's a huge part here. And then the second part here is making sure we establish the right relationships with the asset wealth. Really. And when I say that, this is not customer relationships, these are data relationships. What are the right temporal trends we should be focusing on? What are associations that can be made? And then a huge part of an effort that we're doing here at Atlas AI in our research and development side of the equation is really understanding causal inference, right? Like what are causal impacts of certain interventions? What are ways that we can actually start assigning outcomes in an appropriate manner based on certain activities that have occurred. And right now it's a very important research phase. We don't want to say that we have the exact answer. It's a huge research and development work for our side, but we'd love to work with different players in order to kind of make sure that we're kind of going about this in the right direction, that it's validated in the right manner so that it can kind of help everybody else as well. And then the last part is open data, right? Making sure that data sets, at least between 2003 and 2018 for asset wealth are available, at least as economic consumption comes through, it's the same context. Population, for us, we're creating a derivative composite layer. And so we want to make sure that's available as well, right? Because this isn't just 100% proprietary generated homegrown stuff here at Atlas AI. So whatever we think, is a good basis and baseline for our internal purposes, there's no reason why the world can't actually use it as well. So there's that situation. And we have a whole bunch of other data sets that are actually going to come through. So happy to go straight into the demo here. And in fact, let me stop sharing my screen so I can reshare another window. Bear with me here. Share screen. You should be able to see my screen now. Could someone, Shruti or Kevin, could you give me a thumbs up
Yeah,
as
you're
soon as
good.
my sharing's done? Okay, perfect. Sounds good. So this is kind of the Aperture platform, right? When you log in, this is kind of what you're going to be presented with. At the end of the day, we're going to collapse the thing on the left-hand side because it's not as important to us. You'll see a variety of different data layers actually get grouped into a series of different product families that we care about. So there's economic indicators, there's going to be more population related splices that are going to come through later. There's electrification as part of like the infrastructure side. And then you also see an agriculture section here shortly as we start to process those data sets and kind of get them into Aperture as well. But if we were to take just asset wealth as an example, right, a quick way for you to be able to really understand what's going on might just be to take a look at the insights and see what like are higher level statistics. This is not really meant for you to immediately make a decision. Oh, great, like Elyse's 22nd to 33rd percentile. Sounds good. I'm going to go off and focus in that area. But this is a really good, like, leading indicator to help you understand where to focus, where not to focus. And this is just the, tip of the iceberg. For us, this was a way for us to articulate that spatial statistics can be presented in a meaningful manner along with the side of the map. I think we might have a few folks here from Esri. There's tons of wonderful tools out there available that can help you manipulate data sets, view different data sets. We're not trying to be another tool here. What we're trying to do is use Aperture as a conduit and as a platform to showcase the data sets and make sure that it can actually be useful in the right context and that you can actually see the data sets in the right confluence in order to make a right decision. So if I was to look at asset wealth and kind of just like zoom in here into the Uganda, South Sudan, Ethiopia region right here, you can see that like this is just at the national level. We actually focus on subnational, local, and settlement layers as well. All of these different geo zoom levels, if you will, are our human-friendly terminologies, but really they just reflect admin 1, 2, 0, and a variety of different point level data sets that we've been able to generate, right? So there are technical definitions available in the tooltips, but really as a way to kind of communicate things a lot quicker, subnationally is kind of, I think, where most people are used to. So if I like zoom into Kampala, for example, you'll see that, like, of course, the urban core of Kampala is just going to have significantly higher levels of asset wealth than even the peri-urban sections. You can maybe even ascertain that a portion of the peri-urban side of Kampala is of a higher asset wealth than another. But what if you actually are trying to do something a lot more granular? Maybe you want to look at a district or ward level. We call that local because sometimes the nomenclature changes from country to country, and we just want to make sure that the definition is consistent as people are viewing our data sets. Here, you can actually see that it's a lot more granular. You're able to understand, okay, things are one way in Kampala specifically, but then if I go here to Mukono, it's just a little bit different. And what if you're trying to do this at the settlement layer, right? So as I zoom in, you're able to understand it's not just a single block color that represents these districts or areas. There is significant variation even within one area. And so if you're trying to focus on interventions or directing a certain amount of capital in one way or another, again, we're just using asset wealth as an example here. You can treat this the exact same way for any other metric that we have. There are significant variations for you to keep in mind. There's another story here, right? That as the peri-urban extension of Kampala is going through, it's not that like all portions of the Kampala peri-urban side are developing with the right level of pace or the same consistent level of pace. You can imagine there's a small block of area here where there is significantly lower asset wealth compared to just 10 or 15 kilometers to the west of it, right? And it's the same story, but in the reverse on this side. So this is a way for you to kind of understand, visualize, and kind of contextualize a way for you to see what's going on across the geography. And just to kind of see and make things a little bit silly, I'm just going to zoom pretty much anywhere on this map here, and you'll see that like the data sets are generated countrywide, right? This isn't just that like I was trying to demonstrate one small area. We can basically do this across the board if I zoom out to the entire country. This applies exactly the same way for population density, for example. I'm just going to go subnational here so you can quickly see what's going on. And I'll also wait just a second here because I think screen sharing is taking a little bit of a lag. There we go. There's population density showing up on my iPad. Great. So let me focus on one other piece before we kind of move on to the rest of the situation here, which is electrification, right? I think right now what you're noticing here is something that's area based. This is taking a look at that nightlight data set and saying, in a given region, whether it's subnational or local, and in a given area, how much percentage-wise of that district is actually electrified. But that's not enough sometimes to actually make the right decisions. It's, I guess, great to know that 68% of the area of this particular region in Uganda is getting electrification, but how much of the population is electrified? This is a hugely important, I think, item of discussion that we've been having internally. And so you'll see another layer kind of come through here just in a few weeks, which is around population adjusted electrification infrastructure. Right. And to make sure that not just the nightlights data in isolation is giving us information, but with the population data, you're actually able to kind of composite those two together to figure out where is the density and weight. But for the context of what we've been doing so far for the COVID case study, we've been using this area-based electrification mechanism in order to really understand, okay, of all the identified healthcare facilities that we have, how many of those actually superimpose on a consistent basis with electricity that's actually being produced that we can actually detect from space, right? And that's kind of our bare bottoms conservative estimate of saying, okay, if that's the situation, then across the country of Kenya, maybe it's a western portion of Kenya near Lake Victoria, these are the percentage of hospitals or healthcare facilities that actually have access to electricity, right? So it's a great way for us to kind of understand, okay, if there are cold storage implications, if there are implications for understanding how vaccines need to be distributed and actually, dispersed out to the communities, that there are implications on how far a person might need to travel in order to get that particular level of care, service, or vaccination at the end of the day, right? One of the things that's important here is also kind of understanding how long it has been since an area got electrified, right? So as I zoom in here, I think one of the things I absolutely want to make clear is it's not Kampala isn't electrified. In fact, Kampala is absolutely electrified, but this is really more so talking about the fact that how recently has a given region been electrified. And as we kind of highlight these little pixel dots, they're kind of talking about within the last few years, these areas have only recently been electrified. And there's significant implications of an area that's been electrified and consistently had gotten electrification infrastructure for, call it, let's say 58 months, versus an area that just recently got electrified. Can there be a reasonable degree of certainty that where electrification infrastructure is new, that perhaps the, delivery mechanisms might be a lot more modern, but the prevalence of electrification infrastructure might not be everywhere to that entire community? We don't have the answers to those questions, but at least we want to be able to surface the ability for people to understand how recently a given region has been electrified. And this is the kind of stuff that we want to do. The last thing I think I'll mention as I zoom out here to the entirety of the continent is the ability to kind of answer the kind of questions we had earlier, right? How many of the areas around the world, or maybe for now in Africa, are where there is 33rd to 66th percentile of asset wealth. Boom, right? So that area is filtered out. Of these areas, where is population density at least, let's start conservative, just do 140 people per square kilometer. Boom, that significantly reduces the area that you need to focus on, perhaps for a survey mission, perhaps for an intervention area that you're trying to ascertain as a size. And then also at the end of the day, how much of that area has electrification infrastructure of no more than 7.5%. Boom. So now you know that if you're going to do a particular intervention and these are the criteria that you're looking for, it's very quickly able to be understood what is the actual statistical information for that particular region, but also how do you go about taking the next steps. And this is where I want to end it, is Aperture is just at the tip of the iceberg. This platform is trying to help you understand where to focus, but what's next is also an important question. How do you go about doing your workflow? And I, as a head of product, would love to be able to kind of have a conversation with any one of you to kind of understand what the next steps are for you. How can we make it so that there are certain processes that we could automate and provide value to you as well? So that's kind of where I'm going to end this spiel. I'm going to stop sharing. And I believe we are about to take a Q&A on the chat side of the equation, Karen.
Yeah, hi, Devin, we have got some questions. I answered some of them in the chat box, but there was one question that I thought could be relevant for the audience as well. There was a question about visualizing our data on the platform and how do we take care of visualization practices, like standardizing those practices across different nations with different data sources. So would you like to answer that question for the audience?
Yeah, for sure. So I'm going to interpret this question to say you've got different types of data sets coming through different countries. And as you're trying to generate one common consistent output, you need to be able to normalize it. Right? And that's within that lens, I'd say we have a variety of internal data processing pipelines that actually take a variety of different data sets at different resolutions. The simplest answer I can give you is at the end output layer, we wanted to do an apples to apples comparison from a resolution standpoint at 2 kilometers, right? And we could have gone more granular with some of the data sets, but we realized, no, it's actually a lot more important to have consistency across the board. So there's that. But if you just take a few steps back and you try to say, okay, there are different places at which I'm grabbing the same type of data, and now I need to normalize it accordingly. That actually requires a lot more, I think, data science work. I think, Shruti, if I'm not mistaken, you've also been kind of helping around on that context, especially when it comes into the agricultural side of the equation. I think on the overall, what exists in Aperture is the most consistent produced data layers that we can actually stand behind and show to our end customers and stakeholders. There are a series of, I'd say, normalization processes for one-off data sets or ad hoc data sets that we've been generating for customer engagements and for a whole bunch of other processes that are related to R&D that also kind of impact it. But it's tough, I guess is the only way I can answer this, and that there's a lot of work that goes into it. The last question here I think I see is, was there a final arbitrator for how this data was displayed? And I think the only way I can talk about that is spatial resolution and temporal resolution. So spatial we already covered with the 2 kilometer thing. For now, we group our data sets in a 4-year chunk, and that's not ideal. And we just wanted to do that because we wanted to get this data out as quickly as possible. We're going to annualize it so that all things are normalized on an annual basis so that things are consistent across the board as well. Hopefully that answered your question, Mira.
Okay. Yeah, thanks, Devin. I think this is also a good time to switch to the COVID case study. So I'll turn it over to you, Karen.
Perfect. Okay, folks, now we're switching from Aperture into the COVID case study that we've mentioned a couple times now, where essentially what we wanted to do as a company was we have our open data that's part of Aperture, our asset wealth data, and we said, what else can we do? So this is what we did. And this is available on the website. And so we're going to talk you through just some of our high level thinking about how we put this data together. And then Shruti is going to talk about the public data assets that are available for download today, exactly what those are, how to access them. And then again, we would love to just hear too about the value of this data for you in your respective capacities. So here I go to share again. Okay. Can you see the screen, guys?
Yes.
Yes.
Okay, so this is our COVID-19 countdown. And so what we did was we said, okay, how do we make this relevant? So when we think about our data, we know that our data, we have data at scale, and there's not that many decision makers in the world that need to use kind of like the magnitude and look at things at a continent level that we produce. So we looked through WHO documentation and we said, we want this to really align with the top. So what we did was we took the WHO Global Allocation Framework that's working on vaccine distribution, and we thought about these 4 major elements: goals, target groups, timing, and boundary conditions. And we said, what data assets do we have currently that we can do to support this? And in addition, and we quickly realized that like our data in isolation is not sufficient to answer any of these questions. So then we kind of zoomed out and we said, okay, what other types of public data assets are out there that we can use in combination with our data to start answering these questions? And then we were able to relatively quickly we had a nice team, about 10 of us, putting our heads together, kind of scattered, looked for data, and then came back and said, okay, there's 4 things that we can do. So first, we can start to look at disadvantaged populations, and we're going to kind of go through what each of those are. Then we can start to look at critical infrastructure and what types of potentially electrified healthcare facilities are out there. And then what we did was we wanted to understand what were the burdens on these electrified healthcare facilities. So essentially we combined our disadvantaged population data with our electrified healthcare data to produce these catchment service areas. And then last, we focused on that last bucket, which was the boundary conditions. We wanted to understand, essentially looking at our data in the aggregate, how those kinds of service catchment areas changed if border policy changes, for example. And again, this data is not meant to be normative. This is not some sort of normative presentation of like, this is what should be done, but this is one way that we're using our data that we hope aids decision makers. So our first level, we said, okay, what types of disadvantaged populations can we identify? And what I settled on was looking at lower income individuals, 60 years and older. And our thinking there was these folks are more likely to be reliant on public distribution campaigns. Higher need for vaccines, higher need for public distribution of vaccines. So what we did was we started with publicly available population data. So for this analysis, we used WorldPop data to get 2020 demographics. WorldPop data is fantastic and it's available at a 1 kilometer resolution. But in order to make it match our asset wealth data, we actually zoomed out a little bit and we aggregated the data to a 2 kilometer resolution. So it can align with our 2 by 2 kilometer resolution data. And then what we did was we essentially just narrowed down the focus. So we zoomed out and then we narrowed the focus to 60 years old and older. And then the next step, we basically wanted to see what this looked like in combination with our asset wealth data. So we essentially just did a data overlay. And what we did was we took our asset wealth data, latest and greatest 2020 asset wealth data, and we looked at the bottom quartile. And so we said, what are the folks essentially at the bottom 25% of income distribution? And what that was essentially merging those two sources together. So then we got the most economically disadvantaged areas. So we looked at where are the areas, the highest concentrations of folks living in that bottom quartile of the asset wealth index. And then all of this in combination allowed us to look continent-wide at a 2 kilometer per pixel resolution of the number of elderly individuals, 60 years old and older, living in the most economically disadvantaged areas. And again, Shruti is going to talk about the actual data that's available for your analysis, but we just chose 60 because it was it's a number that defines elderly in a lot of WHO documentation. Places I've worked in the past, we've defined elderly at 55 and above. It was a relatively arbitrary cutoff, but that's why we selected 60 and older. Okay, so that was essentially component one, where we used our data in combination with public data to do an analysis of disadvantaged populations. Second part was we wanted to look at the critical infrastructure. So we, as we all know, a lot of the vaccine distribution is really reliant on reliable electricity. A lot of these vaccines that we all are starting to rely on require cold chain, reliable storage. So we knew there was something there with our electrification data, but we didn't have healthcare facility data. So again, we went out to see what was out and we found two really great data sets. So first, it was this Maina et al. Team that has this really phenomenal data set of healthcare facilities in sub-Saharan Africa. And then we combined that with facility data for Northern Africa. And essentially what we did was put those together. So we have a continent map of all healthcare facilities across the continent. And then this is just for illustration's sake. So again, we have this data for 49 countries, but we just zoomed into one, Kenya chosen at arbitrary just to show on a more local level. And then what we did was we essentially overlaid that with our electrification data to understand from our perspective, looking at an aggregate space, where are the electrified healthcare facilities? And again, because our electrification data relies on nightlight data, we realize that there are facilities in there that may have alternative sources of power that are not caught by this. But what we wanted to do was to produce data as a tool to help decision makers start narrowing in on areas that are basically grid electrified and therefore probably have more reliable and constant electricity sources. So then again, This is shown in for Kenya, but we have this data for 49 countries across the continent. And then this was just another layer of analysis. We essentially wanted to say, okay, basically like these healthcare facilities, supply chains are huge. So what we did was we took a publicly available data source that looked at entry points. And again, this is continent-wide publicly available data that looked at air and seaports. And essentially, we just did a mapping of distance in between the distance from point of entry to electrified healthcare facilities. Again, it's distance as the crow flies, so we don't take any sort of like road consideration. We recognize that that is a thing, but we just wanted as the distance crow flies from port of entry to these electrified healthcare facilities. And then what we wanted to do was understand the burdens on these particular facilities when it comes to patient caseloads. So what we did was essentially overlaid our data of disadvantaged populations and looking at where these healthcare facilities lie to understand the number of disadvantaged people that these facilities are likely to serve. And that's pretty like elegant in the build out there, but it's essentially we're just providing that data. And then we zoomed way back out again, and we wanted to understand how those numbers and those values would change, assuming borders were closed or open. So this particular one was more of like an academic thought exercise where we started to say like, okay, these service catchment areas, there's going to be ramifications when borders open and close. So it's just creating a tool so decision makers thinking about things in the macro can see how things change, assuming there's the ability to have cross-border traffic or the inability to have cross-border traffic. So it's a pretty binary analysis there. And again, we are very proud that we can put this out there in the open. So all of this is available on our website. You just need to click download, and then you're going to get access to all of this data, which over to Shruti to explain what exactly you can get.
Sure, thanks, Karen. So after all of this analysis, we also wanted to make public some of the data we produced as a result of our COVID case study. So Karen already walked through all of these different elements. So the first thing that we are providing as part of our public data is just the list of electrified hospitals with their lat and lawns. So this is essentially just a CSV file with a lat and lawn of each electrified hospital in the entire continent. The second data set is the port of entry to electrified hospitals linkage. So this is that airport/seaport to hospital connection that Karen displayed in the case study. So this is just going to show you the point of entry, the lat and lawn, and the final point, that is the electrified hospital, and also like a distance in meters or kilometers between those two. The next data set that we are providing is the catchment service area data set. So what this essentially is a set of polygons for the entire continent, similar to the ones that we had on the case study for Kenya. So what you'll get as part of this is just those polygons which define the service area of each hospital, the lat and lawn inside each polygon for where the hospital in that polygon lies. For each of these polygons, we are also providing a couple of aggregated statistics, such as the total population living in that area, the average wealth of the population living in that area according to our asset wealth data, the population over 60 living in that area according to World Pop, and then also the disadvantaged population living in that catchment area. And disadvantaged population here is defined as we described in the case study, that is the people over 60 living in the poorest quartile over the continent. And then lastly, it's also going to provide you the average distance each person over 60 living in that area would need to travel to the hospital in that area. So we just hope these are some statistics that can help decision makers when they are actually deciding on COVID-19 vaccination strategies. Of course, there are many others that could be useful, but these are what we are starting with. And then lastly, we are also providing the raster data that was our that we produced as a result of the cross-border strategy impact analysis. So this is a 5 by 5 kilometer resolution that, raster that is essentially a vulnerability index per pixel for the entire continent. And this assumes that all national borders are closed, the vulnerability index when national borders are closed. And the vulnerability index is defined on the basis of the distance to the nearest electrified hospital and what that distance should be given pixels population and what it actually is. And that difference determines whether a pixel is more vulnerable or less vulnerable. So yeah, these are all the data sets that we are providing. Yeah, happy to take any questions, and yeah, over to you, Karen.
Thank you, Shruti. So yeah, this is where we are. So we would love to hear from the group. Any thoughts, questions about the data construction, questions about the download, how this type of data could be relevant to your work. If there's anything that came to mind of like, oh, that's close to what we would need, but actually we need to kind of have similar data in a different way or different age groups.
Yeah, it seems like there is a question that just came through from Trevor, that like perhaps maybe this could be important from a logistical standpoint to use like road network information in order to understand routing, and then also perhaps using like mobile data if you had access to that to understand travel time measures, because like there isn't that much Google traffic related information probably in most parts of Africa. Karen, what are your thoughts in terms of kind of figuring that out if we wanted to consider that?
Oh, now I see the question. Yeah, road networks are huge. Like we recognize that this would make the analysis essentially just so much better, because we really just could do as the crow flies, and like that's not that valuable thinking about logistics considerations. So roads is definitely something that we are just starting to think about and really start to tackle. It's really neat. This is a cool collaboration that we're doing with Marshall's team at Stanford, because they're trying to look at some really interesting new ML techniques that help to do roads. And so we can start to think about like road surface quality, road width, and then like some IRI measurements. But it's definitely like the next frontier of where we're going. Right now, it would just pretty much be reliant on like an OpenStreetMap database if we wanted to overlay and start to get a little bit more accurate assessment of those distances. And then mobile data. No, we haven't started to be able to think like that yet, but I would love to hear more if you had some ideas about how either that could work individually or in combination with publicly available road data, new road data.
Yeah, I'd say, if we had like, a solid like telco partnership that was a trusted partnership where we could get access to anonymized data, like that would be wonderful. We've done work as Atlas with spatial anonymizations. That's totally possible. But I think there's a privacy consideration first that we probably need to take before taking in mobile data just for now. It's totally a valid approach. And I think depending on where you are in the world, it is much more procurable, and it should. We have had access to that data and we could have anonymized it, we would have used it, but I think across the course of the entire continent, it was a bit tougher to get that. There is one more question that just came through. I'm just going to read it verbatim since I haven't had a chance to read it either. Do you also provide estimates of the accuracy or precision of your estimates at the pixel level? I'm sure the availability of the underlying data varies widely across these geographic areas, and I'm curious how that affects the data construction. That's Maria Ruth Jones asking that one.
I can take that one, Devin. So in terms of the COVID-19 case study, the answer to that is no, we don't provide any accuracy estimates or with the publicly available data that we are giving. But we do have these accuracy and validation statistics for at least the Atlas data that we are using, especially like the electrification data and the asset wealth data. And you're correct in that like the validation and accuracy and precision estimates vary widely across the continent. And currently we are also trying to better understand it. Like we're trying to better answer those questions of which are the areas where our own inbuilt data is the most reliable. And in terms of the other data, the publicly available data that we use, the World Bank data or the healthcare facilities, we're relying on what's out there, and their precision accuracy estimates. Yeah. Do you have anything to add, Karen or Devin?
Just adding to that, like Shruti is actually leading this work in our reliability and validation. And so soon, hopefully within the next 2 quarters, we're going to start putting out reports. And then again, in the spirit of just wanting people to test this, we're thinking about different formats that we can put it in. We'll just start putting out as more like white paper series coming from Atlas, but looking to academic collaborations essentially to get external validation to kind of test the numbers that we put out there is high on our list, longer list of to-do things. Yeah. Okay, Trevor, yep, we see yours. Yeah, would love to. We'll talk to you guys. Excellent. Perfect.
Oh, cool. Nice. I saw that GitHub link. I'll happily take a look up.
Yep. And just an FYI too for folks, if anybody here that's on the call, I know Trevor, a lot of your colleagues are part of like the WHO, UNICEF, GIS task force, GIS task force for COVAX. We just joined, I know Ben's on it, so we just joined that as well. So we're going to be trying to push this analysis to more folks that way. So hopefully more folks can get their hands on it. And then if anybody knows too that's out there of any other sort of working group that might benefit from this data, the COVID case study data, or our asset wealth open data 2003, 2018, please let us know. Excellent. Okay, so maybe we'll give like another 15 seconds so it's not super awkward for questions, and then
Great. Yeah, thanks, Karen. We can wait a little bit for some extra questions, and yeah, I think we can potentially take our 10-minute break between this session and our final 2 sessions of the day, and yeah, we'll wait a minute for any other questions.
Okay, excellent. And then while we wait, as I said before, I'll go back to sharing my screen, put up email addresses. So please reach out. If anything popped in your mind, you want more information, you want more clarity, you want to get on the list for when we put these validation reports out there, please email us. This is my email, karen@atlasai.co or .us. Devin and Shruti's is the same, just we're all still small enough that we can still have first names. So reach out to any of us. We'd love to hear from you. Perfect. Thanks a lot, Sam and team. It's really nice to be able to connect. Oops.
We got one other question, Karen.
Okay.
Thanks so much for this. Yeah, go ahead.
No, go ahead, Shruti, go ahead.
It's about our business model and who are our typical customers at the moment.
Oh, perfect. I'm sorry. Can you read it? Because if I have my screen share on, so I can't.
Okay.
See.
Yeah, it says, thanks so much for this presentation. I'm also interested in your business model. Who are your typical customers at the moment?
Yep. So right now, basically, we have this hybrid model. So we're operating like a professional services group. So this is where Shruti and I sit. So we right now do work with World Bank, with the LSMS team in the ag space. We're very proud of our working paper that just got released, that has some really cool data and protocols that we produce from Malawi and Ethiopia as part of the 50 by 2030 initiative. We are working actively with the bank, talking to Trevor, a lot of other teams to understand how our data can be useful for different endeavors, both our data as it stands, and then we also do a lot of work in like what we call operational research, of really just like putting heads together. That's a combination of World Bank or another client with Atlas plus Stanford affiliates to think that how we can basically like leverage our methodologies to kind of push the envelope on some new emergent technologies. Also in what we call our impact world, which is our professional services space, we have a really nice collaboration with the National Science Foundation of a small business kind of grant that we got from them that allows us to go into different spaces. We're operating a little bit like a traditional development sector. So we go both after like posted grant opportunities, like the Gates Grand Challenge, for example. We have a nice consortium of folks that we're looking to test out some new exciting opportunities in Ethiopia with a consortium, and more of like a traditional, like being responsive to grant opportunities from the pretty traditional payers in the spaces. And then we also, kind of concurrent to that, we operate a commercial business that's really focused on Aperture sales. And so that part of the business, which Devin is heavily involved in, and then we also have a head of sales. So they're actively talking to commercial packaged goods, to telcos, to finance institutions, ad tech firms. So basically like anybody that might be able to kind of more use our data as is and plug into their systems to help for decision making. So we're operating those two pieces of the puzzle. And we're still new, so we're still at the place that we're really starting to hone in our scope and go after certain market segments, but we still have this nice little bit of runway, more of like product discovery. So a lot of just talking to different people in different spaces, getting more ideas about who this data can be relevant for right now, what it would need to change to like kind of morph into in order to be relevant.
Yep, that basically answered it for my side too.